A bipartisan Senate duo is working to reignite efforts to cap the cost of insulin for everyone with private insurance rather than just Medicare. Updated legislation introduced by Senators Raphael Warnock and John Kennedy, excuse me. I'm for thinking of the Trump official. These names are all so similar. On Thursday, vote would cap the price of insulin at $35 for everyone on private insurance and would also extend that discount to the uninsured. During a roundtable with reporters, Warnock said he understands how people with diabetes can suffer if they can't afford insulin. The cost of insulin has skyrocketed in recent years, even as the drug itself has remained virtually unchanged from when it was first discovered more than a century ago. As a pastor who has sat in waiting rooms with families and prayed at bedsides, I know the human cost of unmanaged diabetes, Warnock said. I've been there and prayed with people when they got the news that their loved one has to get an amputation. So there is the financial cost and there's the human cost of all of this. Warnock said he intends for the bill to be fully paid for and that Senate Majority Leader Chuck Schumer is all in with his support. The legislation would require private insurance plans to cover insulin for no more than $35 per month beginning January 1st, 2024. Unlike other bills aimed at lowering the cost of insulin, Warnock and Kennedy's Affordable Insulin Now Act would also include the uninsured. By making preventative care more accessible, this bill would reduce long-term health care costs for individual patients, avoid devastating complications from diabetes, and take pressure off the entire healthcare system, Kennedy said in a statement. A provision capping insulin costs at $35 for Medicare beneficiaries was included as part of the Inflation Reduction Act, but the commercial insurance piece failed to get the support of 60 senators to overcome a filibuster. Yet 7 Senate Republicans voted to keep the private insurance cap in the bill. Josh Hawley, Susan Collins, Cindy Hyde-Smith, Kennedy, Bill Cassidy, Lisa Murkowski, and Dan Sullivan. Warnock said he is having conversations with them, but has not picked up their support yet. The bill from Warnock and Kennedy is not the only congressional attempt at tackling insulin cost. Last year, Collins and Senator Jeanne Shaheen spent months working on 35 insulin cap legislation that aimed to lower the overall price rather than just what patients pay. But the legislation not advanced, and the senators have said they plan to introduce it again shortly. Hawley also introduced a bill earlier this year, capping the monthly price of insulin at $25 a month for those who are enrolled in both private health plans and Medicare. More recently, Senator Bernie Sanders unveiled a bill earlier this month that would cap the cost as low as $20 per vial. That's the best one out of these, to be honest with you. 3 of the leading insulin manufacturers recently announced their plans to reduce the price of the drug, including Eli Lilly, and Warnock said he thinks that is that is momentum that will help move the legislation forward. So, insulin cost in America is not something I discuss very often, but as you can imagine, it's pretty lousy. If I remember correctly, we pay about 3 or 4 times what other countries do for the same exact drug, which is already insane. Um, what's interesting about this story is that you have a Republican senator, like leading the effort to try and get the price reduced and to cover people that are uninsured, and that's already ironic when you consider that in recent history, Republicans have been very responsible for getting people uninsured and making sure that they don't have any benefits. But my theory for why he's doing this, along with Cassidy, the other senator from Louisiana, is that their state is what is, how do I put this? It's got a lot of problems. It ranks among the least educated, the least employed, the highest number of drug-related deaths. It is. It has been for many years on the steady decline, and that doesn't mean the people over there are bad and everything. Quite the opposite. I want all of them to get health insurance, but when you have a situation like that where it's just so dire, it really doesn't surprise me that a lot of Republicans that come from that state, or even ones that come from states like that, would be inclined to go, hey, the people in my state we have the highest of any state of drug related deaths. We need to do something about all this, the lack of access to this stuff. That's something that unfortunately says a lot more about the condition of the state versus Kennedy and Cassidy like actually wanting to assist people. I think what they're trying to do is they're trying to make sure they get their reelection, because Louisiana right now has a Democratic governor, and I'd say out of any of the southern states, it's probably the one I expect the most could go to Democrats. So that's a lot of this has to do with them trying to act in a bipartisan way to keep their seat. But again, I'll take it. What really is so unfortunate, though, is that you have this bill that's good, lowering the insulin cost is something that I do support. You have a bill that's good. You have bipartisan support where it's like six or seven Republicans backed it before. And yet, even with over 50 plus votes, a majority of the Senate backs this bill, or backed the previous, the one they were talking about before, the overall effort of keeping those uninsured, in there as well, and private insurance as well. And yet somehow it doesn't pass because of the stupid filibuster. And the Democrats, despite having bipartisan support in the majority of the chamber willing to vote for this, or at least support the overall idea, they don't campaign on this. And that's what drives me crazy about them, because when you have a majority of the Republicans in the Senate who are against doing something, we're not talking about single payer, we're not talking about adding a public option, we're talking about taking drugs that everyone knows have been steadily skyrocketing in price for decades now, and reducing them to an amount that people could feasibly pay for. And they're against that. But see, this goes back to my frustration with Democrats, because they should campaign on things like this. They should say, hey, some of us want a public option, some of us want Medicare for all, some of us, like the Republicans, don't want to give you any further coverage. They want you to pay $100 for insulin while someone in Canada can pay, $20 for it? Which is one of the reasons that Sanders' proposal was my favorite of the lot, that it was trying to make things fair. Although I know that's something that people in America, particularly our office holders, are typically against. So really, I like the bill. It's unfortunately probably not going to pass, because I don't see 10 Republicans flipping to support it. And that's a shame, because what should happen here is there should be some series of senators, it could be most of them, it could be all of them, who get together and say, you know what, for the rest of this year, let's make this an issue of Republicans versus lowering insulin costs. Let's work with the 7 that are going to team up with us and treat them well, whatever. But that other 40 plus, or excuse me, that other 40 that we should go after and go to their districts and go to their states and rally the people and protest. I guarantee if they did something like that, they would easily get another 5 or 6 votes. But it doesn't seem like they will, and that's really a shame, because there are a lot of people, not just in Louisiana, but across the U.S. that can't afford this overpriced drug.